Health Minister, Dr. Joe Phaahla, delivered his 2023-2024 budget speech in Parliament this week. Phaahla revealing that the budget allocation for the National Health Department has shown a decline of 4.4 billion rand. He's attributed this to the impact of COVID-19 and the economy, also the issue of load shedding. Let's speak to the Minister now to understand exactly the challenges that face his department. Minister, good morning to you, and thank you very much for your time. I've got to open this discussion with the situation of load shedding, and I'm reading a tweet from one of the international news anchors, Richard Quest, who has written, and I quote here, "Power cuts of up to 12 hours a day are now normal, with worries of a power collapse." How are hospitals coping with this?
I'm afraid your volume is a bit of a problem. Maybe I heard the quote, but I didn't get the question.
I'm asking, Minister, how are hospitals coping with this?
Well, that's how we are managing, but it's not sustainable in the long term, because we have made sure that all our hospitals have generators, but the generators are meant essentially for emergency purposes, and they are not able to sustain all services. They have to sustain the life-saving, functions in the hospital. So if you look at the services like your boilers, your laundry, the sterilization services, some of those which depend on really high power, electrical capacity, they have to be set aside from time to time so that the emergency generators can only focus on the life-saving areas, your ICU, your theaters, and all those areas which need where is essential for life-saving. But also because the generators have never been meant to run for 10 to 12 hours. They're just very expensive, but also maintenance. It means that they need to much more regular maintenance. So it's both in terms of the disruption of the normal services, but also in terms of ramping up high costs for just running a hospital.
Yeah.
So it's not really sustainable in the long term.
Minister, that was a deliberate opening, that tweet from Richard Quest, because what it tells us is that this story of the energy crisis in South Africa is no longer a matter of national interest, but international community. People are looking at us and watching this situation very closely. Do you support the refusal by your fellow cabinet minister to exempt hospitals from load shedding as instructed by the courts?
Well, I don't consider it as a refusal to exempt hospitals. Remember that the order of the court, I must admit, I haven't seen the original text, but from the reports, the order says that all health facilities, which we're talking in this case, over 400 hospitals and over 3,500 clinics and health centers. So you're talking at just in the health sector over 4,000 facilities.
And you should be jumping for joy, Minister. I'm sorry to cut in. You should be jumping for joy, because no. For you,
I would love that. I would love that to happen, but I'm realistic, Kole. I'm also realistic. I mean, it's one thing to make a ruling. It's another to know what is happening. I mean, I'm being realistic to say that. And it's not just health facilities, but it's also schools. So I do understand that the Minister Pravin Gordhan would like this to happen as well. But the fact of the matter is, from the reports which we receive on a regular basis, almost on a weekly, if not every 2 days, from himself, from Minister Mantashe, and now from Minister Ramokgopa, from Eskom themselves, on a daily basis, the kind of update which they give the nation.
Yeah.
I'm just looking at the fact that that will be really a very good, exciting news if by magic wand, tomorrow we were to be informed that the grid is now strong enough to can provide all our 4,000 health facilities with uninterrupted power supply. That's what we want.
What do you tell patients then? What do you tell patients then, Minister, when they hear... When they
as I'm saying to you...
Let me complete this question, Minister. I'm sorry to cut in. Let me complete this question. A report came from Port Alfred suggesting that senior government officials who were holding meetings there, I think it was from the 8th to the 13th, were able to call an Eskom systems operator to say, exempt this region from load shedding for the duration of this meeting. And yet, hospitals where people need life-saving machines are not exempted from such. What do you say to the South African public in order to sympathize? You are sounding very sympathetic right now towards your cabinet colleague.
No, I think don't misinterpret me. What you are referring to is something which I'm not familiar with. Who are those people who were able to get Eskom executives to say exempt this area? You're telling me something which I'm not familiar with. I need to understand the details of whether what you're saying actually happened.
If it is found out, should it be fired?
I mean, if it's for something nice to have, which is not life-saving, I think there should be very strong action taken. If somebody is going to cajole Eskom executives to exempt a particular area for something which is actually non-essential, I think a very strong action needs to be taken because we are in a situation where essential services can't be fully exempted. We are grateful that some areas, some of our services do receive uninterrupted power supply, but we would like ideally that all our health services should be exempted.
Yeah.
But what I'm saying to you is that being somebody who is familiar with the information of, I mean, all of us, we have unwillingly have to understand how the electricity situation works, what are the risks, and so on. It's not the best of things. Otherwise, we would have liked the situation where we focus on our responsibilities, and things like water, electricity should not be issues which we have to, all of us understand in detail. But by virtue of the situation, even yourself, today you understand that there's a trip of a power station. Those are not the things which ordinary citizens need to bother themselves with. But that's the nature of the situation we're in, and especially for those of us in leadership, we can't promise people what we know is not going to be realistic. That's all that I'm saying to you.
There are two other important issues that I've got to deal with you before we're out of time. The description of healthcare facilities in South Africa. If you were to capture it in just one sentence, what would your description be?
Well, I would say that our health system, especially the public health system, because that's the system which carries, the services for 85% and sometimes even up to 90% of the population, when even those who are on medical cover, their benefits run out. At some stages, especially in the latter part of the year, the public health service carries the responsibility for up to 90% of the population. I would say that system is under stress. That system is resilient, is continuing to provide services to the vast majority, up to 90% of the population. It needs significant, resource injection so that it can be able to improve. But what I can describe is that we have men and women out there who are doing their best in the front line, saving lives, and the system is resilient. That's what I would say.
So under stress but resilient at the same time. How do you hope to improve it when you have told Parliament that you are severely underfunded?
Well, we are appealing, and I mean, even as of yesterday, I was speaking to my colleague, the Minister of Finance, and we have agreed to meet so that even under this stress, we know that the economy is not performing, and therefore revenue is not at the level it should be. And of course, when there is more severe load shedding, it just means that even that revenue is going to be less. But we have agreed to meet to look at essential areas such as the human resources, the frontline health professionals, nurses, doctors, and other support staff who must be really protected. The infrastructure, which we are grateful in terms of some of the allocation we have received, but we would wish for more equipment, which we also want to make sure that it's protected, and also in terms of other essential components of the services, our laboratory services, and also in terms of our health information system, which also needs to be improved so that people, when they go to our facilities, they can receive their records speedily and make sure that they don't have to wait for long times. Yes. So those are the things which I've raised, and we do have scheduled meetings with the Minister of Finance and his team and my team to look at the essential key areas which is going to need, protection from budget cuts, but also possibly some further cash injection.
Some people listening to you, Dr. Phaahla, are going to say the minister is embellishing here. Baragwanath Hospital, the Chris Hani Baragwanath Hospital, is in the news once again, not for good reasons, but people cannot be fed. Well, at least at some point. You had the Dr. Rahima Musa Hospital, Mother and Child Hospital. You were there when the Health Ombudsman released a report. It's a dire situation, Minister. Again, perhaps I need to pose the question to you. You're not embellishing. Are you saying that the healthcare system in the country is stressed but yet resilient?
Well, let's just take the two hospitals you have mentioned. There are management failures. I want to say upfront that Gauteng is one of our biggest, health service provider. In fact, the biggest in terms of on the provincial scale in the country. It carries 3 central referral hospitals, training hospitals, 3 medical universities. So, but at the same time, over time, not just now, it is one of the provinces with the most unstable leadership. Right from the political leadership, if you look into the history of Gauteng, it's the province which stands out as the most unstable at the political, starting with political leadership. They've got numerous MECs in this 6th administration alone. I think Gauteng is currently on their 4th, if not 5th MEC. So that's not very helpful if you look at the administrative level. So I'm just saying to you, while I'm saying overall, the system is, the public health system is resilient, but there are areas of failure, and many of those over and above the objective conditions. It's also subjective in terms of leadership failure. Yeah. So I've had with the previous Premier Makura, we have had discussions and agreements in terms of things which needs to be addressed. Similarly, with the new Premier, I've had meetings and agreements with the Premier Lessufi, and we are following up on those areas, including stabilization of political leadership and also management. As we speak now, Gauteng doesn't have an head of department. It's got an acting head, and that affects the running of the hospitals like Chris Hani Bara and all the frontline services in the province.
Minister, if I could quickly latch on to the management failures that you speak of. The Tembisa Hospital has a CEO who is on suspension, if my information is correct. And it's got to do with the corruption that went on at that hospital. Why is that person still in the job?
Well, we live in a constitutional democracy, Oli, and the rights, this is a rights-based constitution. So every individual have their rights. That CEO is on suspension. There's investigations, I'm informed, have been completed. If not already started, about a week ago when I was talking to the MEC, they were ready to proceed with disciplinary charges against the CEO. They might have already started, but we were talking last week at the Presidential Health Summit, and she assured me that they are ready, okay, if not already started. So he's got to face due process. He must be charged. He must be able to defend himself, and only if found guilty, then he can be relieved from his responsibilities. That's how our system works.
Finally and briefly, Minister, yes, we've spoken about a lot of doom and gloom, but it actually isn't in some aspects, because the anti-HIV injection will either be made or produced in South Africa. Tell us the benefits that are going to accrue.
Well, the benefits which will accrue is that, currently, in terms of prevention of HIV and also treatment, especially, compliance with the treatment, because once you are tested positive, then it's a lifelong treatment, and now we rely on pills. There's been a lot of good improvement even with that, because earlier, 10 years ago, people who are on treatment for HIV would have to take about 10 pills. And over time, this has been improved to the level where they only have to take one pill. But when the injection is also now confirmed to be effective, which is almost there, and also approved by our regulator, South African SAPRA, what it means is that, because this is long-acting, it means that instead of a pill every day, people who are on treatment will only have an injection possibly once a month or once every 3 months, and therefore the compliance with treatment and therefore viral suppression, and viral suppression means you can't transmit the virus. It will go a long way in terms of helping us to manage the HIV epidemic.
Health Minister, Dr. Joe Phaahla, I'm thankful for your time. Thanks indeed.